AstraZeneca is responding to criticism of its coronavirus vaccine from a U.S. science agency. The drug maker will release up-to-date results of the final stage trial of the shot within 48 hours. The U.S. agency had said that AstraZeneca's analysis of the vaccine's effectiveness included old information. Johns Hopkins Center for Health Security senior scholar Amish Adalja discussed this on Bloomberg TV, also explaining what public health issues need to be addressed in the U.S. after the coronavirus pandemic has been contained. Take a listen.
I think that this pandemic virus, because of its ability to really prey on people with other risk factors, really had an easy time finding victims in the United States. And that's because we have very high rates of obesity, cardiovascular disease, and diabetes. Those three conditions really were kindling for this virus to be able to find victims and land them in the hospitals and put all our hospitals into crisis. That, coupled with the way our nursing homes have been handled, really explain the trajectory in many parts of what happened with this pandemic. So I do think we have to address these other public health concerns. And these are things that are going to be difficult because they're lifestyle diseases. That means that we have to tell people that they need to diet, they need to exercise, which are very hard to do because doctors have been telling people to do that for so long. It's just very hard to do. I think that this really lays bare the problem that we have. And the next pandemic, even influenza seasons, are exacerbated by these comorbidities that we have. So I do think we have to really think about how do we make our country resilient to pandemics? And that's not just diagnostics, vaccines, medications, and hospital preparedness. It's also getting the population as fit, as healthy as possible so that this virus or any other virus doesn't have so many easy victims around.
This is an issue that's been on the public's radar in this country and elsewhere for a long, long time, Doctor, as you know. Where do you think we have fallen short? And if you'd like to see a renewed effort out of the capital at a federal level, how would you like to see that develop in the months to come?
I think it's very hard to come up with a program that's going to be effective against these types of lifestyle diseases because it's so multifactorial. And the government can't really tell people or expect them to diet or exercise as they say. But I think what you want to do is maybe launch an education campaign about how this happens in the schools to get people to be more healthy about their choices that they make. I don't know how much of this can be done from a top-down approach. It's very, very hard to do. It's not my expertise about how to change behavior this way, but it's clearly something we need to fix. And it's going to take an all-out effort to really address these problems, which have been chronic and long-standing in this country.
Yeah, and I will say there has been discussion about whether we are underemphasizing some of the side effects from some of the shutdowns and the prolonged bouts of isolation. I mean, I was looking at this one study that showed that 42% of Americans reported gaining unwanted weight, and the average weight gain was 29 pounds during the pandemic, just to give some sense. And as people isolated, not having anywhere to go, drinking more, feeling like they are trying to fill their time with prolonged stress, a very difficult period of time. As we move toward the end, it is understandable that people want to be done with this, which is why we're seeing crowds on Miami Beach, which is why when we go see restaurants, there are people packed in even before the pandemic has lifted. Do we really have a big risk of a third wave as people are just tired of the pandemic and say at this point, whatever happens, happens?
I think that the United States is going to have some uptick in cases. Whether or not it looks like Europe, I think it remains to be seen. I think what's better in the United States than in Europe is we have a much more robust vaccination program. And the goal is to get as many people vaccinated as possible. And we're doing that, getting 2 to 3 million people vaccinated. So I do think we're probably able to stay ahead of the worst consequences of people's lack of social distancing. And the other thing is what we're seeing is a decoupling of cases from hospitalizations and deaths, because we've now got a lot of people who are living in nursing homes, a lot of people that live in the community with high risk factors vaccinated. So we are going to see cases go up, but hospitalizations and deaths basically remain the same or go down, which is happening in most of the country right now. And I think that's going to change the way people think about this disease. It becomes a more manageable respiratory infection. So the goal is, we know people are going to be doing this. Our solution is to keep vaccinating as quickly and as fast as possible so that those individuals are less likely to spread this virus and we're not impacted the way Europe is. I don't think we're going to have a European trajectory based on just our vaccination numbers alone.
Well, there you have it. Dr. Amish Adalja, senior scholar at the Johns Hopkins Bloomberg School of Public Health. The Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, founder of Bloomberg LP and Bloomberg Philanthropies.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.